Assalamu alaikum, good evening and welcome to another program of Health is Wealth. I am your host Shabnam Riaz. As always, it's a pleasure to be here. We get lots of feedback from you on our program and issues that are important to you and the things that affect us all. And basically this is a program that wants to impart you with knowledge about those things that have many myths and facts merged together. Now, we've had tremendous response on our dermatology skin programs, and we're very happy to do another program on dermatology, and also it's a pleasure to have with us again Professor Ikram Ullah, who's the head of Department of Dermatology, PIMS, and also consultant dermatologist. Thank you for joining us again.
Thank you. Thank you very much. It's always a pleasure to be in your program.
Likewise, thank you very much, Dr. Ikram Ullah. Okay, so before we speak to Dr. Ikram Ullah, we are going to show you a report.
5 most common skin disorders. Acne. Acne is a very common skin disease. It appears most often on face, neck, shoulders and back, and it comes in many forms. Eczema. Eczema is a type of chronic skin disease that can affect people of all ages. It makes your skin really sore and itchy. Skin cancer. Skin cancer is the most common type of cancer in the world. It can damage any part of the body. It is commonly a result of sunlight exposure. Psoriasis. It is a chronic and disfiguring genetic skin disease. It affects both skin and joints. Warts. Warts are ugly and very embarrassing. They are common and caused by a viral infection by the name of HPV.
Okay, hopefully you found that informative. Now we're going to turn to our expert in the studio, Professor Ikram Ullah. Tell us, the thing is that when we speak about dermatology, and especially when we're talking about aesthetics and cosmetics, you'll find that people are really willing to invest so much money. What is ironic is that sometimes you find people who have other health issues would rather give how they look the priority. So how do you cover patients and how do you counsel them to get their priorities right and also to not go to the wrong people or the wrong procedures?
Yeah, well, that is a very, very important question, and I would like to answer it in this particular way. If you ask a woman, or if you ask one particular person, like obviously, the most significant thing that matter. Maybe I'm biased against this particular, or I'm biased in favor of this. They would give priority to their face. Obviously, everybody
You're not
would
biased,
like to,
that's absolutely true.
Everybody would like to see
True.
and want their face to be presentable, to be better looking, to look youthful, to look pleasant, to look at themselves and if somebody else is looking at them. Okay, obviously I agree that heart is a priority, or kidneys can be priority, or lungs can be priority, but nobody has seen your lung, heart, liver. I, for example, have not seen my heart. My mother has not seen my heart. My lungs, my kidneys, most probably I would not see them. And nobody will, but everybody would see my face. Now, if I walk into a room, they will not recognize me by my what type of a kidney I have or a heart I have, but they will recognize me by my face.
Right.
So that is why it is very important that in my aspect that at least the face should be looking good. As far as the heart is concerned, there are, we can look into that, and there are so many myths. At times you say that the cholesterol is bad for you, and then you come up with some good cholesterol, and then the theory changes altogether. Sometimes, oils were in popularity. Now it is back to the basic. It's the desi ghee that has become a popularity. Sometimes they say that you eat egg, and then it says that you don't eat egg. So there are so many issues that are still not clarified. But as far as face is concerned, obviously we know how to make a face better, and what are the things that are good for the face to make it more youthful and make it more presentable.
Let's face it, this is a booming industry at the moment. I mean, there is just such a huge margin for people to get ripped off.
The first thing that you do when you go and wake up, You go to the washroom. What do you look? The first thing in the morning, you look at your face. Even if you are up for the Fajr prayers, you do your wuzu, you see your face. And if your face looks fresh at that time, you feel happy and you are happy throughout the day. At least this happens to me.
Yes, it affects your well-being.
It affects your well-being.
Mental,
Don't you think that that particular effect that affects your well-being will also have a very positive influence on your lungs, liver, heart and kidney? Our system, our whole body is programmed by brain. There are apoptosis, programmed cell death, that all can be changed. There are different stem cells in every organ of the body, all controlled by the brain, and they can be stimulated at any time. Well-being is something that creates positive energy in you, and it influence certain factors in the body that will, prevent you from heart attack, that will prevent your kidney to deteriorate. That is very important. Why somebody, when all of a sudden, they lose hope in life, or something tragic happens to them, they do not survive for a long period of time. Why? Because there's so much negativity, there's so much hormones that and the oxidants and the free radicals, they start getting produced in the body, that they destroy your every system in the body.
And I suppose that, when you feel good, when you look good, you feel good, and then you're releasing all those happy hormones, those endomorphins and everything.
Endorphins, and that is just one particular thing, endorphin. There are so many hormones which, at the moment we are not able to detect in our body because we do not have the machines, the diagnostic approach, the parameters to monitor or to identify them, but they are there in the body, like maybe after 100 years we will be able to come to know about them, but they are there, and they are responsible for the longevity, for your health, and for your fitness, and also for the fitness of every organ in the body.
Right.
And well-being is very important. So at least one thing, that when you look at your face, you feel happy. That endorphin, that adrenaline rush in your body, pumps many positive hormones, I would like to say, or factors in the body that will affect your well-being throughout the day. When you wake up, you look at your face and you look bad the whole days, bad. Some people say that it's a good hair day, some people say that's a bad hair day. When they had a bad hair day,
that will dictate their whole day.
The whole day will be dictated by that bad hair day.
Absolutely true. Absolutely
so
true.
that is very important. Very
Does
important.
that sort of make a society more prone to being more superficial? How do you create that balance?
Basically, it's not the matter of superficiality. Obviously, the first thing, and in 90% of the cases, people do that for themselves. Obviously, you wear clothes and you wear, you feel like looking good. You wear perfume. That does not show that it is superficiality. That shows your character. That shows how you are. The way you conduct, the way you talk. Well, whether if you talk in a very sugar-coated way, does that superficiality? No, that shows that your inner self. Like that. That shows it's a person. Provided it's genuine. Like provided we reach within we stay within the limits. Provided we do not cross the limits.
Right. Have you ever had a patient you have had to sort of say to, that I don't think this is the proper treatment for you, this is unnecessary? Or have you ever had patients like that?
At least, and I would be very honest, 30% of my patients who visit me every day, I tell them that this is not the treatment for you, and and I just don't abruptly tell them that I'm not going to do for you. Because then they would say, okay, the doctor is rude, or the doctor does not know how to do it, or the doctor somehow is avoiding me. I sit with them and I spend more time with that patient in convincing them, and in a very logical manner, that this particular treatment would not be good for you in the long run, or this particular treatment that you are seeking for would not affect your looks in the way that you would like to feel like. And at times people have got dysmorphism, their skin or their eyes or their lips or their nose would be looking absolutely perfect, but they somehow are not very happy with it. So I have to explain to them in a very logical manner by different supporting arguments and try to convince them that this particular form of treatment that you're seeking for would in fact actually deteriorate what you already have.
Right.
So that is very important for the doctor to do that. Now here comes the ethics. Then what you are talking about, the superficiality, over here superficiality will come. Now if a doctor whose main aim is to generate money, you know, if the profession has become a business, then in that particular person, that is the type of person they would cash upon. You know, that is the right candidate, because that particular person is willing to spend any amount of money on their face, and the doctor would cash on the you know, like not the imperfection or the wrong idea of a patient that they have about themselves, and the doctor will cash on that and will in fact come under exploitation.
Right.
So it is superficiality on the part of doctor, and that it is superficiality on the part of patient also,
Right.
because they are seeking something that would not be achievable, but it in the end would be beneficial for the doctor, and it will be a deterioration for the patient. And when the patient goes into that vicious cycle, then they keep on changing doctors, and they keep on being
Gets out of control.
exploited by every
I see.
particular professional or non-professional person that is there in the
Right.
in the
That is,
market.
of course, a huge responsibility there. Okay. As you are, you know, one of the leading people in this field, tell us about the main bulk of problems that you're seeing in patients, and what treatment is.
Obviously, we have to categorize the main bulk of the patient that I see. They're the patient who come to my clinic or to the hospital for different purposes. Some of them have got skin diseases, like most of them have got skin diseases, and quite a few of them have got problems, like you can, in inverted commas, you could count aesthetic problems with the face. As far it could be, for example, abnormal hair on the face, or it could be wrinkles, or it could be blemishes, or it could be melasma, that hyperpigmentation on the face, or it could be stuff like that. But the other part, that is the aesthetic part. The normal dermatological, the disease part would be that patient with different type of skin problem, and among the most common problem that usually come across in this particular field are different type of allergies, eczema, dermatitis, what we call it. Could be a contact dermatitis due to detergents or cosmetics, stuff like that. That psoriasis, there is one other particular condition which is a form of a disease that is also very common. Then there are different infectious diseases. These days, I see a lot of patients with heat rash, with that malaria.
Because of the weather?
Because of the weather.
Okay.
Miliaria rubra, you know, like we call it pith in Urdu.
Right,
Pith.
yeah.
Miliaria rubra, the whole body is covered with the small little pustules, and that occurs because of extreme the hot weather and humidity, and when there is not enough ventilation in the space, or there is no facility of air conditioning, and the tremendous amount of load shedding that is there, unfortunately, in our society, that is adding up to the patient's problem, basically.
Right. So what is the treatment for that?
Basically, the treatment is that one should stay in a cool environment, one should stay in a ventilated place where there is not much of humidity, one should take a shower at least once or twice a day, or if water is scarce as it is, then they can at least do wet sponging with a wet towel. That is very important. Drink a lot of water. That again is very, very important, which will, you know, dilute the secretions and they will sweat. One thing that also is also beneficial, and nobody has so far emphasized on this particular point, is exercise. If you exercise regularly, where you sweat properly, the incidence of miliaria rubra is not that much. You know, so exercise again is very important.
Right.
And provided that you do exercise in the open air, not in these fancy gyms where when the power shut down and are still struggling on these machines, you know, you get more of miliaria rubra. So exercise is very important.
A walk, an early morning walk.
Early morning walk, or in the evening walk, when there is not enough strong sunlight, that
would irritate your skin.
That will be is the best, and you will not get this kind of a heat rash. Plus, you know, wearing clothes that breathe, like
Cottons.
cotton cloth, that is very important. Some people use a lot of makeup, and in fact they use makeup on their body also. That will give rise to miliary rubra. So these
What
are the
about
factors.
using those lotions and those powders that are very popular?
Obviously, you know, like in one of the recent programs that I did, one of the best moisturizer is the pure aloe vera. Aloe vera is a very good moisturizer that does not clog your pores. If you put too much thick greasy stuff on the skin, and it is a occlusive moisturizer that occludes your pores and stuff like that, one would get more of a miliary rubra, because you're putting a sealant on your body, you know, that will, it is
Trap
okay in the
everything
winters
inside.
because you try to trap the moisture. But in summers, obviously, you know, that is not required, because that will in fact create problem like miliary rubra or pith.
Okay.
So it is important to use a moisturizer that goes inside the epidermis, that goes inside the skin. And aloe vera is something which is not a occlusive moisturizer. It is something that will moisturize the top layer of the skin, the epidermis, by actually penetrating the epidermis.
Right. Because I was asking before the program as well from different people about, you know, what their skin issues were. Many people spoke about scabies as well, the myths behind it, what exactly it is, how it's spread, how it should be contained.
Yes, scabies is a very common problem. We see quite often, especially in my PIMS OPD. I see about 20 patients, 25 every day of patient with scabies. Now, scabies is a small particular parasite.
Okay.
Sarcoptes scabiei, that's the name, that's the generic name of this particular parasite, and it is a highly communicable disease. It is transmitted from one person to other. What it does is create small little tunnels, burrows inside the skin, and it lays eggs over there, and it multiply, you know, by thousands in a day. So once that bug goes into your skin, or you are infested with that particular bug, it will affect every part of your body, except the face in adults, but in children even the face can be affected. And the hidden areas, those are the most common sites which are affected by this particular bug. Now, the most important thing how to treat scabies is not only to treat the particular patient in point, but also treat all the family members at the same time, whether they are suffering from this particular disease or not, because they may be having scabies. It will be in the latent phase where they are not having the symptoms, but later on they will have. And there are particular lotions available, and the application of those lotions is also very important. You just don't tell the patient, okay, this is the lotion, you just write to them on a piece of a paper and then send them away, because they would not know how to use it. You have to sit and explain that you have to use this lotion below neck, everywhere on the body. Not a single part or area of the body should be left behind. Somebody should wear gloves and use it on the back where they are not able to reach themselves. And after that, they should wear very clean clothes, wash clothes, and all the bed linen and the bed sheets and the place where they sit should be cleaned, washed, or sprayed with all those pesticides, stuff like that. And all the members of the society should treat themselves at the same time.
Right.
Okay. Now, that is one thing. Plus, and they should leave that for 12 hours or so, and then they can take a shower and apply it again in the same manner for 2, 3, 4 consecutive days or consecutive times. Now, patient, we explain that, but we do not. Sometimes the doctor fail to explain to them that once you go to the washroom, you wash your hands, or you do a wuzu, all the lotion will be washed off from there. You have to reapply it again. That is very important. Reapply it again on the areas which we have come in contact with water. So if you do this particular treatment in a proper way, then you will be able to get rid of the disease. But usually, what actually happens is that sometimes the little children, they acquire it from the school. So there are other classmates who are suffering from the same condition. So all the family will get themselves treated, but this particular child would go to the school again, and he get reinfested with the bug. So you have to inform the the class teacher, the principal also, that my child has got this particular problem. Most
And
probably
getting
he
it
has
from school.
acquired it from somebody from the school, and somebody is infected. So the whole class should be treated with that.
Right.
So it is not just a simple problem that you can eradicate. Lot of
Hard work goes into
hard
it.
work goes around, and lot of explanation and has to be given to the patient and also to the patient relatives. To, you know, they should know
To
the gravity of the
educate them.
situation, how to get rid of this particular problem.
Right. Is it okay to wash clothes in disinfectants? Is that?
No, that is ordinary detergent is good
Okay,
enough.
that's okay.
I would not recommend these disinfectants. It may
Okay.
further aggravate skin problems. You know, these particularly so-called disinfectant soaps, they have got ingredients that are detrimental to the skin. They can cause
And
contact
hand
dermatitis.
sanitizers?
Sorry?
Hand sanitizers, are
Hand
they okay?
sanitizers are okay, provided they are used judicially. No,
Okay.
you know, like it's not that hand sanitizer should be for, you know, like you just use hand sanitizers. Soap and water is quite good enough.
fine.
That is
So
absolutely
the
a normal soap, not all
Right.
these
The
disinfectant soaps. They
I
are
see.
more of a problem. They show on these TV ad that you know the hands are full of germs, and then they are
Exactly.
wash them with this magic soap and the bacteria disappear. That I don't think is that
Okay.
much true.
So that is a very good tip that Professor Ikram Ullah is giving, that stay away from the disinfectant soaps, because actually normal soap and water will do exactly what
Yes.
what you want, but without the harmful side effects.
But obviously, you know, one have to sterilize themselves. I'm a cosmetic surgeon also, sorry, cutaneous surgeon, and then I have to use the Savlon, you know, to disinfect my hands. So that's a different ball game together. But I don't keep that in my washroom and use Savlon all the time. I only do it when I'm going to operate on a patient. So
Right.
that is a different disinfectant,
Requirement.
which is obviously required for procedure which requires that there should not be any bacteria or any dirt around.
Right. Okay. Folliculitis.
Okay.
Tell us a bit about that, please.
Follicle, as you would understand, is a follicle, hair follicle. Folliculitis means infection of the hair follicle. A very common problem. People get into the scalp, in the head, and once they get it, the folliculitis is such a disease that if it is not treated properly, it can destroy the hair follicle. Folliculitis will kill the hair follicle, and not just one hair is affected, a group of hair, a patch of hair is infected with folliculitis, and that folliculitis will lead to cicatricial alopecia. Now, cicatricial alopecia means it will be a scar formation in the scalp. Hair will never come back in that particular area. It looks very, very bad. The main source for folliculitis, in my experience, is that it comes from the barber or these beautician shops.
Oh, this is infectious.
Yes, obviously it is Staph aureus bacterial infection. And how is the infection transmitted? Now, a barber, they cut your hair with the same scissor, with the same comb, and with the same hands, they cut somebody else's hair. A person before me who had folliculitis, and the same barber they do my hair job, I will be infected with this particular bacteria if I do not have enough immunity against the Staph aureus bacteria. So this is how folliculitis spreads from one person to other person.
Right.
The other common problem that I see folliculitis is waxing. A lot of women come to me, they go to these beautician or these wax shops, and after the wax they develop severe folliculitis. Brides, they come to me, the whole back, the front of the chest is covered with all these small little follicles on their wedding night, and they are in tears that what can we do about it? So this is a very common problem and can be avoided.
How to avoid?
Obviously, I would strongly recommend that when you go to a barber shop, obviously we all go for the haircut or whatever we do, we should have our own comb, our own pair of scissors, and it's not very expensive, 800, 900 rupees, you can get the whole set. You take that, you to the barber, ask the barber, please use the sanitizer or wash your hand, and then you can cut my hair. So that is a very important measure. One can prevent folliculitis, because prevention is easier than cure.
the cure.
Because once folliculitis occurs, Staph aureus bacteria such that it changes its form very quickly. So it becomes resistant to antibiotic in a very short period of time. At times we have to use very heavy doses of antibiotics, or we have to resort to vitamin A analogs or drugs that are meant for tuberculosis in order to treat folliculitis, and it just does not disappear in a week or 10 days. It may take months. By that time, so much damage is done to the hair that, you know, patient loses 50% of the hair.
Okay.
Okay. Now, let me explain that also. If I lose my hair when I had this hair transplant and also PRP treatment for my hair. That's why you see this patch on my scalp.
Okay.
Androgenic alopecia, male pattern baldness. Now, it's a very common problem. It's a genetic condition, and you see bald men all left, right, and center. So, but they don't look bad. Why? Because it is a normal phenomena. It's a natural phenomenon. That is how nature has given them androgenic alopecia. But folliculitis, if you see that particular patient, that looks diseased scalp.
Okay.
You see patches of hair and you see patches of hair with bald patches. So that looks very weird, very diseased, very, you know, like not very pleasant to the eye. So you know, like that particular baldness then looks ugly. And unfortunately, there is not much that we can do. Even hair transplant would not work over there.
Not work there.
Even the
Okay.
PRP treatment, platelet-rich plasma treatment would not work in case of folliculitis.
Right.
Because there is nothing over there. The hair follicle
So what
is
are the
gone.
symptoms for someone if they're not sure about this disease? And
The initial symptoms are that get small little pustules, small little bumps filled with pus at the base of the hair follicle. This is
Okay.
folliculitis.
right.
It's
right.
at times painful, and when they scratch, it is also itchy condition.
Right.
It will bleed and it will have this yellow pussy discharge.
And the treatment you're saying is you start with antibiotics?
Antibiotics, absolutely. Antibiotics. And some of the patient can get folliculitis by shaving process or like some men get it over here, especially in the neck area. That folliculitis is usually because they, you know, shave themselves on daily basis, and somehow or another, you know, the hair may be ingrowing. So the best treatment for that is laser hair removal. And in
Okay.
female also, you know, if they are constantly doing waxing and can't get rid of the folliculitis, then the best treatment for that is
Laser hair removal?
laser hair removal.
Okay.
A lot of patients get folliculitis on the chest because they have got a very hairy chest. And again, the treatment for that is hair removal, because you keep on giving them antibiotic for years and years and nothing is going to happen, and you know, like it's a painful condition.
Okay.
It affects you. It's constant pain all the time. You cannot concentrate on work or on anything. That will also create a lot of negativity in
Of course, in a
the
person's
person.
well-being.
Yeah.
Okay, you mentioned waxing and lots of women, you know, going to beauty parlors and things like that. And how can they protect themselves from getting folliculitis or any other skin
Obviously,
problem?
you know, the first and foremost thing to prevent folliculitis is cleanliness. Now, I explained to you one aspect of mode of transmission of this particular bacteria, the Staph aureus bacteria, which can be transmitted from the person who is the technician or the cosmetician who is doing this particular procedure. Their hand may be dirty. Our skin also has got Staph aureus bacteria. Okay, so if somebody is going for waxing, they should properly cleanse their body also
Okay.
with you know, antiseptics before they go for waxing, and make sure that all the material that is used is absolutely clean and new, and it has not been used before, and the person who is performing that particular procedure should wear protective gloves and do the waxing.
Right.
But cleanliness of the body is very important, because what actually happens is that in waxing you forcefully pull the hair out. You create vacuum when the hair is taken
Okay.
out of the skin.
Right.
It creates a small pocket of vacuum into that hair follicle, and it sucks in the bacteria that is present on the skin, and that is how folliculitis occurs.
Right.
So it is very important that you get rid of the bacteria that is already there on your skin.
Okay.
Staph aureus bacteria can be a normal commensal or a normal flora on our skin.
Right. Okay, so that's another really, important tip that Professor Ikram Ullah has given us. If you're going to the barbers, he was saying you're going for a haircut, take your own comb, take your own pair of scissors, make sure that, take some hand sanitizer with you as well. Make sure that whoever is cutting your hair has sanitized their hands. I mean, it's your own health. And the things that Professor Ikram Ullah has told us, I mean, those things are just something that you just don't want to deal with. So these are all those preventive measures. And if you're going to a beauty salon, you're going for waxing, then this is also, he said, make sure that you've cleansed your skin properly with antiseptic. And it's basically just a hygiene in general.
Absolutely.
Okay. Now, Professor Ikram Ullah, tell us about pharmaceutical companies. They're also jumping on the cosmetic, opportunity as well. How aware should people be about what they're buying, and where should they be a bit more careful?
Obviously, that requires a lot of knowledge on the part of a doctor. That requires a lot of experience on the part of doctor. And knowledge, experience, plus doctor should have a brain which is able to analyze what's true and what is not. This particular industry, people are making billions of rupees, billions of dollars in fact, and most of these pharmaceutical companies or these big companies that are producing all these different laser machines, they are based in all the inverted commas first world countries. Now they spend billions of dollars on advertisement, anti-wrinkle cream, how effective that is. You can get an anti-wrinkle cream that is worth more than 100,000 rupees. Does it work? Does it cross the basement membrane, go to the dermis, stimulate the fibroblast to produce the collagen? Answer is no.
Imagine.
Number one.
Right.
Okay.
Okay.
Then there are other machines, small little gadgets, little things, like I don't want to name the machine, but it's I think half a kilo machine, and the guy was selling it for 80 lakh rupees. I said, what is this particular magic box, a light-weighted magic box is going to do? It's going to, rejuvenate the skin and get rid of the wrinkles and stuff like that. How does it work? What does it do? So one has to understand that.
Right.
And like that particular machine is so popular, it has got such a huge name because billions of dollars are spent on it by the company who manufactures it.
Of
If the
course.
machine costs 1 lakh rupees to the manufacturer, they spend 10 lakh rupees on advertisement.
Advertising.
And that advertisement
and
also is to make some of the doctors have a world trip and in luxury hotels and first class tickets and stuff like that. They pamper them so that the doctors come back and they yep about the machine. It's a very tremendous machine. This is how these companies are making money. So one needs to understand the basics.
Behind
one needs
this.
to understand the science behind the machine,
Right.
how it works. You have to be very logical mind in order to understand.
And do your
these things.
research before you're getting into
Do your research.
Right.
Do your research. It's something you have to have a passion for it. Even if I'm doing a research, I'm reading, I have to have a passion for my work. I have to have my brain to, understand how this particular thing is going to work. I have to convince myself before I can convince my patient or before I sort of convince the person who I'm operating upon.
Right, okay. We'll get back to you, Professor Ikram Ullah. Right now we're going for a break. Don't change the channel. Okay, welcome back to the program. Yes, we've had a really informative program. Thank you so much, Professor Ikram Ullah, for being with us again and giving us such valuable tips. Now, you know, the subject is just so diverse. There's so many things people want to know about. Unfortunately, we don't have time today that we can dwell into everything. Tell us about the sort of the new things that are on the market in the laser and the sort of cutting edge technology, whatever, to sort out.
A couple of things that are new in the market. One is a laser known as it's a Pico Q switch and diag laser. Now, so far the Q switch laser is a nano millisecond technology. Now, this Pico Q switch is a 1/1,000,000th of a millisecond technology. So, what's the difference is that this Pico laser creates a photoacoustic effect in the skin, and it destroys the pigment cell inside the skin. It's a very good laser. I'm the first one to have it in Pakistan. It's a very good laser for pigmentation, melasma on the face, for hyperpigmented marks on the face, for skin rejuvenation, and also for patients who have got tattoos. It's a new laser for that particular matter. Now, the other new thing that is up is a smart lipotriplex cellulase. Some people have got cellulite on their body. They may be very lean, but you know what is a cellulite? Cellulite is on the skin. The skin is tethered down as if there is when you button those. You know, the Chesterbury sofas, when the skin is tethered down.
Sort of puckered.
Puckered, absolutely, like a small little depression over there. So cellulase, this smart lipocellulase is a machine which breaks the cellulite and it brings the skin up. Currently, I am also doing some research work so that I can, you know, some of the acne scars that are puckered down to the skin, I can cut them with this laser fiber inside the skin so that the acne marks comes up. And some patients who have got depressed scars, like due to surgical scars or trauma scars or accident scars, I'm also trying to cut the fibrous tissue underneath the skin so that the skin comes up, so at least it does not look like a depression. And then on the top you can treat that machine. So these are some new treatments that are there up in the market. I'm very excited with this Pico Q switch laser and would like to see how effective the results are. It's an expensive laser, but I would see, and I would like to compare it with the normal usual Q switch laser and see how effective it is on melasma. So far the results are promising, but obviously, you know, one cannot make a generalization. I have to treat at least a few hundred patients before I would be able to very clearly say how effective this particular laser is. But the concept, I always whenever I go for a technology, I go for the concept. I would like to understand myself. I have to convince my brain that this particular laser, though the laser company is making so much tall claims, whether it will be effective or not. This laser, because it's a 1/1,000,000th of a millisecond laser, this Pico laser, it creates a photoacoustic effect in the skin. Now, photoacoustic effect is that it does not create heat inside the skin. It will destroy the pigment, but this photoacoustic effect, like a shock wave sort of a thing. So it will fragment the bigger, larger pigment particles into much smaller particles rather, and would not produce heat. On the other hand, a normal Q switch laser does produce heat inside the skin and it destroys the pigments, but that heat can also stimulate subsequent post-inflammatory progress. So at one stage we are treating the hair follicle, the pigment with the Q switch, but at the same time we are producing some post-inflammatory hyperpigmentation. I hope this particular Pico laser would not produce that hyperpigmentation or hypopigmentation, where too much of the pigment is destroyed and even the normal pigment is destroyed in the skin, and you get this white dot on the skin, which usually you see, come across a patient coming from different clinics where the Q-switch laser is inadvertently used or, overly used on patients for which they do not require.
Right.
I must say one thing over here to my audience, because a lot of clinics, they are doing this particular sort of a, they would like to camouflage their inefficient laser by, what they do is, for example, for hair removal, they would use a low-powered Nd:YAG laser, a outdated machine, and in order to cover up their inefficiency, they would use on top of that the Q-switch laser. Q-switch laser is not a hair removal laser. Let me tell that to the public, to all the patients who are fooled by these different doctors that Q-switch is a hair removal laser. Q-switch is not a hair removal laser. It will only bleach the hair. It will only retard the hair for 1 or 2 months, and that's about it. It is not a hair removal laser.
Right.
In the long run, it may cause paradoxical hair growth. So what most of the doctors these days are doing, they do this inefficient hair removal long pulse laser, not the latest machines, and then they go up for the Q switch to cover up their inefficiency and try to make the patient happy and make clients.
Right.
This is a very bad practice. One should be very honest with the patient, like when, like if you have to, I think, this is one particular field where cheating is bad, honestly, like you're playing with the health of a patient, I think that is very bad.
But then at the end of the day, Professor Ikram Ullah, the thing is that a reputation always supersedes a person. So when somebody has been to a doctor as yourself and they've been guided in the proper direction and they've been able to sort out the myths from the facts, then that thing doesn't stay in one place. That travels around.
Can I say something over here? Most of these doctors who have got this reputation, you see them on these morning TV programs every day.
Good question.
So the reputation is built by the media for these particular doctors. So if they, ruin 3 or 4 faces, but billions or millions see them on the TV as celebrity doctors.
Exactly.
Yeah. I would request the media over here using this, most prestigious channel in Pakistan.
Exactly. Yeah.
Please do not entertain unethical, non-qualified doctors, or I would call them actors rather than doctors. Right. Sorry, now I have great respect for actors, but these are, pseudo actors.
No,
they act that they are doctors, but they are not doctors, in fact.
Exactly.
Yeah.
Just what you're saying is absolutely very true.
And you see all these unethical doctors on the morning program every day.
We have a huge responsibility in every profession that we are associated with, and we have a huge responsibility to work with ethics. Professor Ikram Ullah, thank you so much for being with us here today. It's been a pleasure as always.
Thank you very much. Same here. Thank you.
Okay, so here we come to the end of another program. I've learnt a lot, as I always do. I hope you have too. This is, again, one of those subjects that is highly popular amongst our viewers, and many people come in with many questions. We hope that you've had a couple of your questions answered as well. The basic is that, look after yourself and research, and don't succumb to just advertising. Make sure you know what you're getting yourself into, and research as well, for, this is your face after all, as Professor Ikram Ullah said. It's the first thing anyone will see when you meet anybody. So until next week, stay happy, stay healthy. Bye-bye.